Hi guys, welcome back to Med Student Notes. Now I'm certain you must have come across somebody that just says no to cake because I can't take gluten. There are people that can't take wheat or barley or rye because they have what is called celiac disease. Now, what is celiac disease? Why does it come about? How does its pathophysiology and clinical features, how do they play out in the human body? Now, celiac disease is an immune mediated enteropathy. This is prominently seen in people of European origin in the distal duodenum and the proximal jejunum. Now, let us assume that a European man has consumed some bread, and we are taking a look at his small intestine. This is the villi, and this is the lumen. So, he has consumed some rice, and in rice, there is a substance called gluten. Now, because this is the intestinal lumen, there are certain enzymes that are going to act on the food that we're consuming, right? There's going to be brush border enzymes from the intestine, and there's going to be a lot of luminal enzymes. These are going to act on gluten and break it down into something called gliadin. Now, gliadin is kind of the villain of the story. And the thing about gliadin is it is so powerful that it cannot be broken down by pancreatic or intestinal or gastric proteases. None of these can break this down. So now gliadin is going to journey down into our villi. These are the villi and these are our enterocytes. These cells right here are the intraepithelial lymphocytes. All right. Now, once gliadin has entered inside, there is an enzyme that acts upon this called the tissue transglutaminase. The tissue transglutaminase deamidates the gliadin, and we have what is called deamidated gliadin. Now, this process is going to happen in everybody. Then why do certain people have celiac disease and why do a lot of us not have it? That's because now if we look down right here, this is an antigen presenting cell. If this antigen presenting cell has HLA-DQ2 or 8, which is not present in everybody, but if this is something that the cells of a person carry, then they become susceptible to celiac disease. This deamidated gliadin that we have is going to be taken by the antigen presenting cell. And what will the antigen presenting cell do? It is going to present this to a T cell. The T cell is going to activate B lymphocytes. And we know that B lymphocytes will give rise to antibodies. There's going to be anti-gliadin, of course, right? Because gliadin is what gave rise to this whole chaos in the first place. Then we have anti-tissue transglutaminase. And most likely due to some cross reactivity, we're also going to have anti-endomysium antibodies. So these CD4 T cells are activating B cells and we are getting antibodies. Another thing our CD4 cells are going to do are activate some cytokines, right? And what will these cytokines do? They are going to cause damage to our enterocytes, right? Now these enterocytes are obviously under a lot of stress because there's damage happening to them. Then what will happen? There is something called the MIC within these enterocytes. So under periods of stress, MIC is expressed by them. Now I've just drawn these intraepithelial lymphocytes here, right? They obviously have a purpose. These intraepithelial lymphocytes have the receptor for this MIC. That is called NKG2D. Once NKG2D detects the stress that the enterocytes are going through, these CD8 plus T cells are going to be activated. And they are going to cause further damage to the enterocytes. Now, we have damage happening to the enterocytes, right? Because of cytokines and because of CD8 plus T cells. So the entry of gliadin is going to be even more easier. Now, if entry of gliadin becomes easier, there's going to be more CD+4 cells generated, more CD8 plus cells generated, and this is going to be a vicious cycle of destruction. So imagine a person's harmlessly having some rice or barley, and this amount of damage is going to happen to their intestine. So they are going to suffer a lot of clinical manifestations. But before we move on to the clinical manifestations, let us just take a look at what happens to the morphology of the intestine. With all this destruction that is happening, the villi are going to get blunted. These are our villi, right? They will slowly get blunted because of all the damage. And this is called the crypt. There's also going to be crypt hyperplasia. There's going to be elongation of the crypts. And we're also going to see a lot of intraepithelial lymphocytes, right? So intraepithelial lymphocytosis is a feature that we see, along with blunting of villi and crypt hyperplasia. Let us discuss the clinical features. It can present in adults from the ages of 30 to 60 to their 60s. See, now, because there's a lot of epithelial destruction happening, there's going to be increased cell turnover, right? Increased cell turnover can cause less time for new cells to differentiate. So there's going to be less cell differentiation. So because of all the issues there's going to be malabsorption. There's going to be iron deficiency anemia. This is pretty commonly found in celiac disease. There's going to be diarrhea. There's going to be bloating. There's going to be fatigue. In children, this can present as failure to thrive. So once they start taking gluten, this will start, right? So after the age of 6 months, the children can start presenting with failure to thrive, loss of weight, diarrhea, muscle wasting. Usually, when there's increased cell turnover, it is very easy for it to develop into cancer, right? So these patients have an increased risk for cancer. It can be T-cell lymphoma, or it can be adenocarcinoma of the intestine. Another clinical feature that you may see is something that is called dermatitis herpetiformis, in which there is pruritus and abnormality in the skin because there's IgA deposition within the dermal papillae. Now, you can suspect cancer if there is refractory celiac disease. That means if the person stops consuming gluten altogether, they're not going to have any symptoms. But even if on ceasing their gluten intake, they're still experiencing symptoms like diarrhea and they still have fatigue and bloating and malabsorption, you are going to want to suspect if they have developed some sort of neoplasia. Next, another very important thing is the diagnosis. I'm going to write this a little more neatly than the clinical features. So, the first thing you want to do is serology. Antibodies that are commonly produced are IgA antibodies. So, first check for IgA to tissue transglutaminase. Now, it is important to remember that there are people that have IgA deficiency. In fact, IgA deficiency is associated with developing celiac disease. So, when you check IgA transglutaminase and this is present, you want to confirm if it is celiac disease by doing a biopsy. And in biopsy, we're going to see the morphological and microscopic features that we had discussed. Another thing in the morphology that I should have mentioned is that there will also be an increase in the number of eosinophils and neutrophils in the upper lamina propria when we do the microscopy of the biopsy. If IgA tissue transglutaminase is not present, the first thing you want to do is check if the person has an IgA deficiency. So first check if their total IgA levels are normal. Because if you just assume based on the IgA TTG that the person does not have celiac disease, you might be getting a false result because they might have an IgA deficiency as a whole. So when you do a total IgA, If the total IgA is normal and if they don't have IgA TTG, then you have to go for other differentials. But if total IgA is reduced, you know that these people have a deficiency in IgA itself. So here in this case, you would want to check for IgG, tissue transglutaminase. And then if this is positive, you will want to go for biopsy to confirm your findings. That is about serology. So this is how you diagnose celiac disease based on the clinical features and serology and ultimately biopsy. And the treatment, most important, is to stop gluten in their diet. So take a gluten-free diet. So this was about celiac disease. Hope you enjoyed it. Thank you. Be sure to like, share, and subscribe if the video has helped you, and do comment. Thank you.